We're glad you could make the time for us. This is Health and Lifestyle, your weekly health show for all matters health. My name is Marie Yambo. Our social media handles at KBC Channel 1 on X and KBC Channel 1 TV on Facebook is where you can interact with us. Now, on the 25th of September 2025, surgeons at the Kenyatta National Hospital conducted a highly complex facial reconstructive surgery. The cranial facial procedure involved intricate facial reconstruction and is the first procedure of its kind worldwide. Now, the groundbreaking surgery positioned Kenya at the forefront of advanced medical innovation. But first, a look at what's coming up in the program. Coming up in the program.
Susu wake alishutua kwa tumbo na Ian akashutua hapa ikatokea na huku.
7-year-old Ian Baraka undergoes world's first facial reconstruction surgery in Kenya.
We're able to do this for the boy. Our interest is not fame or anything, but to bring some reasonable life to this young boy.
A 9-hour cranial facial reconstruction, a first of its kind in Kenya, uses 3D printed implants. A warm welcome once again into our first segment where, at just 7 years old, little Ian Baraka has already faced more pain than most adults could imagine. But his cheerful, playful nature hides a story of courage and resilience. On December 23, 2023, armed bandits attacked villagers at the Isiolo-Meru border, and a stray bullet struck then 5-year-old Ian in the face. The bullet pierced through his lower jaw, shattering his teeth and nosal area. Since then, he has undergone extensive treatment to rehabilitate the damage to his face. And on September 25th, 2025, Ian underwent what doctors at the Kenyatta National Hospital termed a first-of-its-kind surgery using 3D implants. His mother, Bessy Kinya, narrates the ordeal her son had to endure in the aftermath of the banditry attack. Let's listen in. At first glance, 7-year-old Ian Baraka looks like any other child. Playful, full of laughter, and bursting with energy. But behind that bright smile is a painful story that began 2 years ago.
Nilikuwa nimeenda soko huko Mtote. Kutoka hapo mimi nikarundi nikakuta hakuna mtoto na hakuna susu, kwa hiyo mboma wakakataa kuniambia imefanyika nini.
In December 2023, Ian was just 5 years old when bandits attacked their home along the Isiolo-Meru border in a violent raid to steal livestock.
Mdogo wake akaniambia, unajua mama, mtoto wetu ameumia. Nikamuuliza ameumia wapi? Akaniambia ameumia usho. Nikamuuliza kwani ilifanyika nini? Sasa hapo ndiye baba yake alitaka kuniongeleza, akaniambia nilikuwa sitaki kukuambia usituke. Nikakuta sasa Ian na susu wake wameenda usinju. Susu wake alishutua kwa tumbo na Ian akashutua hapa ikatokea na huku.
A moment that changed his life forever.
Hii macho moja ni kama ioni vile kama hii ingine juu hii macho ilikuwa imeumia na hii sendi yote ni kama ilikuwa imeumia yote. Alikaa sana bila kutembea. Lakini nashukuru Mungu juu Mungu aliona wacha atembee. Sasa anatembea, anakula tu hivyo akiwa anajimwagilia chakula hivyo, lakini tu bora anakula.
Since that day, Ian has been in and out of hospitals, enduring multiple surgeries to reconstruct his face. Bessy Kinya, Ian's mother, is grateful to have her son alive.
Bienye yako ni wangu na bienye Mungu ameona abaki hivyo ni wangu. Nikamkubalia bienye yako na hata saa hii mimi naamini Mungu kila kitu itakuwa sawa.
And now, almost 2 years later, doctors at the Kenyatta National Hospital are preparing for one of the most complex operations ever attempted in the country, a cranial-maxillofacial reconstruction surgery. Using advanced 3D modeling, this team of surgeons has created a custom prosthesis depicting Ian's injuries.
This is how the patient looks like. So we are going to try to work out so that we have a face here, and the patient then can be able to look like any one of us. That is a plan. And so we had to come up with a patient-specific implant.
The implants to reconstruct Ian's face includes this titanium alloy that will form the base for holding the teeth and nose prosthesis. Professor Simon Gudua, an oral and maxillofacial surgeon and the lead surgeon on the case, explains why this procedure is so unique and how it sets the stage for future surgeries.
It means that we can lay a foundation now of how to do these cases now, how they can be done. We'll have a program of how it can be done. So we will say it does not affect the growth takes place. Then that's why we take good pictures so that one can see where we were and now where we are 5 or 10 years ago, 10 years to come. And that will now help other patients. It's very rare that you get a shotgun injuries to children. And that's what makes it very, very moving.
His mission is clear.
We feel humbled that we're able to do this for the boy. Our interest is not fame or anything, but to bring some reasonable life to this young boy.
The day before surgery, Ian is taken to the dental lab where Dr. Margaret Mwasha, the prosthodontist and surgeon, carefully inspects the prosthesis to ensure everything is in perfect condition.
Hapa tutakuwa tumefunga sasa, sawa? Unataka kuiona? Inakaa kama wewe. Fungua kidogo sasa, fungua hiyo. Haya, fungua.
The maxillofacial prosthetists meticulously adjust the prosthesis to match Ian's complexion for a more natural appearance. Bessy listens with hopeful anticipation, praying for a successful outcome.
Nategemea tu atafanyiwa surgery, Mungu akiwa mbele na ataamka vizuri na Mungu amlinde na amuongoze, maana hakuna kitu kingine, ni Mungu tu peke yake. Mimi nimepeana huyu kwa Mungu. Hata kama hatarundi vile, lakini itakuwa correct. Ndio hata sahi, hata alikuwa ananiambia yeye anataka kutengenezwa aende shule, ndio alikuwa anaenda hata shule.
Not only that her son can return to school, but also that he will finally be free from the stigma he has endured. Indeed, a very intensive time in the surgery room. I sat through that surgery for 9 hours and watched as the team of doctors worked to ensure a successful surgery for Ian. And of course, Ian has been recovering well. We wish him all the best. And on that note, we come to our first break of the program. I'll be back with much more, delving deeper into what this cranial surgery is all about. Thank you for staying with us. The pioneering procedure was performed by a multidisciplinary team of maxillofacial surgeons, orthodontists and ENT specialists led by Professor Simon Gudua, lead oral and maxillofacial surgeon. Dr. Margaret Mwasha, lead consultant prosthodontist, explains what it took to conduct this complex surgery and how using 3D implants is a game changer in such surgeries.
Ian sustained injuries to his face. You can see the nose and the upper lip are not present, and some of the tissues around the cheek. Now he also lost a bone. The upper jaw is missing, and he also lost teeth. So these injuries of Ian are on the face, and we tend to work as a team. So the maxillofacial surgeons tend to do the reconstruction and I do the rehabilitation. Now those two, reconstruction and rehabilitation, are two sides of the same coin. So what we are working on right now on Ian is the phase 2, because phase 1 was already done. He was stabilized. As you can see, we have a national referral system. So he came from Meru, from a level 5 hospital, was referred to Kenyatta, the National Referral Hospital, because he had quite some extensive injuries, and he required a lot more support. Now the support he's getting, I think in terms of skill sets, we do have that in Kenyatta National Hospital. Yeah.
And so this is a groundbreaking procedure that you're going to be performing on Ian, in just a day. So maybe you can take us through that. What is so special about this particular procedure?
Yeah, so as you've seen, Ian, the defects are quite grotesque. I mean, he has to walk around as a 7-year-old boy with a mask. Speech is still not very, very coherent. He feeds, yes, but it's still a bit of a struggle. So the reason this is novel is that he's a young boy. Traditionally, what happens is with the reconstruction, they tend to harvest bone, and many times bone from the foot, an extra bone, I would say, called the fibula, and they use that to reconstruct, and we use that for supporting our prosthesis. But in the case of Ian, because he's a growing child, the tissues are still very small, the blood vessels are very small, so connecting them would almost be impossible. Actually, we had a team meeting, a multidisciplinary team meeting, where we felt the bones were not adequate in terms of size and the blood vessels also. So this is groundbreaking because we've used technology, working with the engineers in Belgium, to come up with patient-specific implants, which is really the most advanced of the implants that we do have. Now, in this case, because it's growing, we've also made sure that in our planning, we anticipated what sort of growth he will have. And so when these were designed, they were made in a way to allow for growth to continue for him. Now, these implants will also allow that he has teeth, and he will also have a nose and lip. Yeah, now again, the groundbreaking bit is that in the designing of those implants, we looked at the sort of forces, especially that come from chewing, from clenching, from biting. We looked at the forces that will be there when he's pulling the nose off and putting it back, and really simulated that. So using technology, we've been able to do what is called finite element analysis, just to analyze the sort of forces and manufacture that which meets those needs.
So the prosthesis will work like a normal nose. His teeth, eventually when it's implanted, are able to, withstand, the pressure of chewing and all that.
Yes. So that we've already simulated, and the teeth will be able to function as his own, actually. So he'll be able to chew very well, and in terms of aesthetics, we are hoping to achieve that which allows him to integrate back to society confidently.
Okay.
Yes.
Talking about groundbreaking, one among, is the first ever. Does this also now present a chance to inform any other form of surgeries? I don't know what kind of surgeries those would be.
Yes, actually, we are responsive to the patient's needs. So we tend to look at our patients when they come in, what do they need? And many times there are gaps because from the severe infections, the severe destruction, when we see patients who present with cancer, sometimes the extent is way more than what has been published out there. So from a clinical perspective, yes, we tend to look at the challenges the patients face and address those needs. Yes. So we have many other patients, I must say that. And for us, really, it's now looking at infrastructure, support to ensure that we meet those needs. As a country that finds titanium, I think we should be manufacturing. Value addition actually should be done locally. And we have many trained young people. We have the engineers, we even have the dentists. I'm sure all this work can actually at some point be done back home here. So it will be more cost effective, and we'll be able to meet many more needs.
Okay.
Yeah.
I can see you have, a dummy that you can explain to us. I think it's just depicting the injuries, or at least, or Ian.
Yeah, so this is a 3D printed model. And what we have done is to look at the remaining tissues. So you can see this is his lower lip. You can see these are the cheeks. And we have put the implants already, okay? And we have put the teeth. So this has allowed us to make nose and lip, which is essentially this. So we've had to use this as our guide. And really, This is what we're anticipating to get
Okay.
once he's reconstructed. Yeah, so in this era of the fourth industrial revolution, where 3D printing is becoming a norm, this is actually a 3D printed model, and we put everything back together. We anticipate that this is what we'll have tomorrow, and this should be able to sit and fit well.
Okay.
Yes.
Just talking about that also, maybe you could briefly, I know tomorrow is a big day for you as the team of surgeons and also baby Ian, but maybe just a brief of what to expect tomorrow. What will be the procedure like?
Okay, so again, it's quite a big team. The team leader being Professor Budua. He's been our teacher for many years. He's been a dean actually at the University of Nairobi. And so he's leading this team because he is very well versed and experienced with these patient-specific implants. Then we'll have Dr. Kiriamu, an oral and maxillofacial surgeon, and we'll have the residents in maxillofacial surgery. Then from the prosthodontics team, I will be there as lead, but I'll also have Dr. Alex Mwangi coming from Machakos County, also joining us in the team. Then we'll have the ear, nose and throat surgeon, because there'll be a tracheostomy done for Ian, where they will put the tube through the trachea, so that then we have this area to be able to work on. Then we have the anesthesiologist team, and I think the team leader will be Dr. Guaro. Yes,
Okay.
she's a pediatric anesthesiologist. So the team will be quite big.
Okay.
Yes.
Would you mind just in a brief again, just telling us, so who starts and who gets where and who, like, yeah.
So in terms of how the workflow will be, the whole team will be present before starting, but essentially the ear, nose and throat surgeon, Dr. Ngigi, will perform the tracheostomy first. That will allow the anesthesiologist to intubate the patient. Once that is done, that's when now the oral and maxillofacial surgeons start working on him. And finally, I will be there to help with the placement of those patient-specific implants to ensure that they are precisely placed. And finally, when they have anchored them in the bone, we'll be able to put the teeth, and then finally we put the nasal prosthesis. Yes.
You know, costs is also a very big thing. Is this subsidized? Is this free? But how much would it cost, you know, for the whole procedure to be done?
Yeah, so costs are have been a major concern, actually have been a limiting factor, because this is work we started planning last year in January. So it's taken us, how many? A year and 9 months, just to be able to raise adequate funds to start the process. So the patient-specific implants are made in Belgium. The cost is €10,500. And we've had a young maxillofacial resident, Dr. Munyasa, doing a couple of marathons to do the fundraising. So I think so far she had raised 750,000, and that's how the company agreed to manufacture for us and ship. So there's still some pending bill. Having said that, I think there's a lot that Kenyatta National Hospital has done so far. Yeah, from ensuring the patient was stable, ensuring that the young boy was getting proper nutrition. We have the nutritional team, physiotherapy, the rehabilitation. So there's been a lot that Kenyatta National Hospital has done, and I think the hospital is also taking this up, and we'll be looking at how to meet the difference. Now you realize any work that's revolutionary tends to cost, especially at the very beginning, and that is what is happening in this case. So the costs are pretty high. I think Mr. John Kariuki, who's a maxillofacial prosthetist, has donated some of the silicone material. I have also donated a bit that I got from my last training in Wales.
So far 700 and yeah, just about that. So yeah.
Yeah.
So is this 2 million like throughout the time that he will need to do many other procedures? Is it going to stop at what age? Is it at 18? I don't know, 25?
Yeah, so we anticipate that once growth ceases, then we'll have the next phase 3 of reconstruction, where tissues will be harvested from his body. Probably bone will be taken from the fibula, from the leg and used to reconstruct, then we'll be able to place dental implants and put a prosthesis for him. And possibly they'll also have some tissue, soft tissue to place on top. Yeah, so that is when growth ceases and probably end of puberty, start of adulthood. Until then, we still will have quite a number of costs because the prosthesis will need to be changed and also the nasolabial prosthesis.
Okay.
Yeah. So there'll still be some costs involved in his treatment, but we are hopeful that even with the Social Health Authority, that some of these costs can start being included because they're really prohibitive. This is really catastrophic spending, and that is why I find it very noble that we have our doctors looking for initiatives to be able to raise funds for our patients.
We've come to the end of the program. Thank you so much for your time in the company, and of course thank you to the doctors at the Kenyatta National Hospital for allowing us just to be in the theatre and to bring you the story of what's happening in the theatre in as far as that surgery is concerned, and also to Bessy Kinya, the mother to Ian Baraka, for sharing her story. And of course, on behalf of the production team that made this program possible, we say thank you. Remember, we'll be having a second part of this particular program just to show you how far Ian has recovered over the past 1 month or so. My name is Maria, and I hope to see you again.